good to see you at the intersection. I'm very excited about today and where things are moving. As you know, this summer we've been looking at all of the community collaboratives that have been forming over these last 5 years and who are active now, and how things have gotten broader yet deeper, and how we can connect into those and where those efforts are. Today, we were going to have the community collaborative that moved into Bridges to Care San Antonio. So we were going to be hearing about mental health. And then our deputy city manager, quite coincidentally, asked if we could have an insight session this morning about those dollars and where those are moving. And so that's what we're going to do. And next week, we're going to have a pause and special guest. Not that everybody isn't special, but Dr. Kara Allen. If you've not met her, she's the new, I think her title is something like Community Impact Officer for the Spurs. And she just talks our language and is engaging the community. And I don't know, a month or so ago, I was able to get that date on her calendar. So just a little bit of, interesting. She's fun and engaging. So that'll be next Thursday. And then we're going to pick up the collaborative work the following Thursday on mental health, Bridges to Care, and that kind of work. So in that light, at 8:01, our announcement this morning is around mental health. Donna, you want to talk up to us, invite us to Pathways to Hope?
Absolutely. I just shared my screen. We do have the promotion of Pathways to Hope conference up on the website. So this is about saving the date. So please save the date on your calendars. August 26th and 27th will be the dates this year for Pathways Conference. And for those of you who don't know, this is a conference for the community. It's really for just everyone, regular everyday people, clinicians who can also get CEUs from this event. But this is where people really can come and get some awareness, much more awareness about mental health, treatment options that are out there that are being proven to be effective. And we're excited to let you know that Dr. Tom Insel, who has written a book, Healing, and especially it's a good connection to our theme this year, which is healing communities. So we're hoping that everyone will be present, let everyone know to save the date and be present with us in August for this Pathways Conference. I'm going to put in chat the link for the website. Registration won't open until the beginning of July, but we're wanting people to put it on their calendars already so that they can be present.
So Donna, is there a registration fee?
No, there's no registration fee. And for the San Antonio, we're going to have on our website the option to purchase your lunch. So you will have the opportunity to purchase lunch at the Tobin. But if you don't want to and bring your own lunch, that's totally okay as well. But outside of that, it's 100% free.
Wow. I've also found, and so I encourage everybody to think this way, this is also great continuing ed for like staff persons and volunteers. And so I know within the department where I serve, Human Services, I get the information out. And a good handful or two of people will come because it's, again, great continuing ed and a way to connect with community, but also in your congregation or in your organization. It really is great education. And I know it was formed really to get the faith community more involved with mental health like 7 years ago. And we've come such a long ways. I mean, the outcome of that is Bridges to Care. So getting not just the faith community, all of community. And now more than ever, with this second pandemic, the wave that came after COVID and the need for mental health wellness, it just couldn't be better timing. And I know too that it's been recognized nationally by Washington. And so this year it's also going to be across the United States with the meat of it happening in San Antonio, but other groups across the country doing this as well. Donna, could you say one more word about the theme of healing community? What does that phrase mean to you or to the pathways?
It means that it is a verb, but it also is about what we're wanting the communities to be: healing. Healing communities heal community. And I can speak to this professionally and personally, you know, at being here at Bridges to Care and seeing the work that's being done in community. I get to see it firsthand. For almost 9 years, I worked with an organization that took my focus was more staff focused, but being on the other side of it and being in community, I'm actually being able to see exactly what's happening in community. And, you know, a lot of faith communities that we work with Bridges to Care are doing some incredible things. And that's how communities heal. And as we kind of like move forth into this year, even more incredible things are going to be happening. And I have the pleasure of being a part of a collaborative now. It's talking about healing because of due to collective trauma. And David Pakta is on I see, because it's time. It's time for people to, one, reengage in community, but two, heal, because we've all experienced this collective trauma. And this is how I'm able to see healing happen, is through community.
Thanks, Donna. I'm now going to, so if you could stop sharing screen, Donna, so that Maria can. I want to introduce my colleague and friend, Maria Villagomez, our Deputy City Manager. And she has come to us, I think, twice already, maybe 3 times, about this funding that's being made across the country, but specifically, of course, here in San Antonio, and explained the process, where it's moved along the way. But, you know, now we're getting to the end run. And so there was a presentation, I think like last Friday or 2 Fridays ago at City Council, and then Maria requested to get some input and insights from our faith and community leadership. So here we are this morning, and Maria, thanks for asking, and thanks for being with us today in such sunshine. I wish it were raining, but I'm so grateful for the sunshine. So Maria, it's all yours.
Thank you so much, and thank you all for having me this morning. Can you all see my screen?
Yes, we can.
Very good. So what I would like to do is use a few of the slides that we shared with the Public Safety Committee on June the 10th, where we staff gather the feedback that we had received from the community back in November when we did our community engagement process. We also had a couple of policy discussion sessions with the City Council and feedback from the Public Safety Committee. And we have a draft plan on how to use the $26 million that have been allocated to mental health from the American Rescue Plan Act. So what I would like to do today is share this with you and get your feedback. This is not a done deal. That we don't have specific allocations of funding yet, but what we have are potential issues that we can solve within the community, potential programs and strategies that we can address. And it will be it's very important for us to know the feedback of our faith-based community, as many of you deal with mental health issues and the work that you do on a daily basis. And you have been partners of the city for many years as we have tried to address the challenges that we see in our community. So my computer may be a little slow. Okay, here we go. So one of the goals that we have is to develop an implementation plan. And the ingredients, if you will, of this plan is to identify COVID impacts that we're trying to resolve. Number two, identify programs and strategies that will benefit our community. I also identify what are the desired outcomes and how we're going to measure those strategies and programs, the effectiveness of that. And finally, that will formulate the plan. So what we have identified based on the feedback that I described are three areas that we would like to focus on. One is addressing behavioral health problems, especially in lower income communities. $26 million is not a lot of money, so we want to be very targeted in our approach, where we have seen COVID-19 impacting our San Antonio residents the most. Number two, we have seen an increase in the number of mental health calls that come to our 911 system, to the city of San Antonio. So we want to be able to address that. And number three, we have also experienced and heard that there has been an increase in social isolation. And as a result of that, anxiety, depression, suicide, especially in school-age youth, older adults and veterans has increased. So those are the impacts that we're trying to identify. Now, for each of those impacts, and just to describe this particular slide that you see before you, you'll see that first impact that I mentioned, number one, addressing the behavioral health problems in Bexar County and lower income communities. And then you see a strategy and program, how we could do that, and then the desired outcomes that we have. We don't have metrics at this time. We haven't allocated dollars yet. And as I go through this, there have been questions about how service providers can participate and potentially apply for funding. So I will cover that as I go through each of the slides. So one of the things that we have realized in conversations with the county, in conversation with the Center for Healthcare Services and the University Health District, is that there's a lot of us providing the services, but we could benefit of having a coordinated approach, a convener that will bring all of us together, the county, the city, the service providers, the faith-based community, to discuss the challenges that we have in mental health, that will help us identify priorities, how, especially the city and the county, how can we better target funding that is available within our budgets to be able to address those issues that we see as a community. And also to be able to focus on services that can help those individuals experiencing crisis, such as stable housing, counseling services, access to medical services. Again, from what we understand, a lot of us are participating in this space, but we could do better in terms of coordinating. Within that same first impact, another strategy is a partnership with Bexar County and the Center for Healthcare Services to develop a 24/7 warm line or hotline where families that are not experiencing necessarily an immediate crisis can call and get assistance in navigating the many services that we have. The goal is to increase awareness of existing programs and services available to families. We believe, based on our experience from the city's perspective, is when somebody is in crisis or need assistance, they call 911. So as a result of that, we're going to send a paramedic, we're going to send a police officer, and that may not be the assistance that family needs. So we believe that creating this other hotline, perhaps use one of the existing hotlines that we have, but be able to promote it and ensure our community is aware of that opportunity. The third one is also a partnership with Bexar County Center for Healthcare Services to develop a public education campaign to address the mental health stigma and create hope for those that are affected by mental illness. We believe that we need to do better in educating the community. So from what we understand as a city is that some of our residents may not be aware, may not realize that they need assistance or their loved ones need assistance. Or if they do, they're afraid of seeking help. So the goal is to be able to do a campaign to be able to address the stigma around mental health. So moving on to the second impact that I mentioned, which is addressing the number of 911 calls that we have seen coming to the city of San Antonio. One of the thoughts, and I believe I may have shared this with you in the past, we have discussions to add an option within the 911 system. So when someone calls today, you are asked, do you want police, EMS, or fire? So our thoughts is potentially to add a fourth option for mental health. That coupled with the education, that coupled with the other headline for pre-crisis, then hopefully we can provide the appropriate level of care, send the right professional to those 911 calls that we are receiving. Now, to that effect, the city created in this budget cycle one team, just one team that we call the SA Core. And this particular team is comprised of a clinician, a paramedic, and a police officer. We are servicing one substation. We have 6 police substations in the city. So it's a pilot program, it's a small program. But what we are doing with that team is when there's a mental health call that comes to our dispatch system, instead of just sending a police officer, we send this team with the goal of preventing an arrest. And number 2, providing the assistance that the individual needs by the professionals that are addressing the call. So we've heard from a couple of council members the desire to increase the number of those teams that we have. So that's another area that is included in here. And finally, within this impact is expanding mental health programs for our first responders, for both police and fire. So moving on to the last impact, which is addressing the challenges that we have seen because of social isolation in our youth, in our older adults, and in our veterans. So particularly with youth, one of the strategy and programs that we're thinking is perhaps expanding access to cognitive behavioral therapy for children and youth. And one of the outcomes is to enhance our mobile mental wellness collaborative with schools. As a matter of fact, we had a discussion with the county and we're going to be talking to the schools next week to see how we could potentially collaborate and be able to expand. The county specifically added $16 million out of their ARPA fund specifically for this mental wellness collaborative with schools. Today, we provide through our Metro Health Department services in about 8 to 10 different schools, and the county is interested in expanding it to all the school districts within Bexar County. So we'll be having those conversations, and that's also a way to leverage not only the city, the county, but also potentially the schools. I had a meeting with the Youth Commission back in May. And what you see reflected is the feedback that we got from that Youth Commission that represents all of our city council districts in terms of having more services during evening and weekends, having a way that they can text confidentially to a professional when they need assistance, and enhancing our crisis assessment teams at schools. Another one is expanding the Project Worth team ambassador program within our Metro Health Department, and also improving access to pre and post diagnostic services for children experiencing developmental disorder. Specifically, what the council was interested in is individuals that are experiencing autism. We understand that there's a waiting list just to be able to get that assessment. So that could be a potential area that we can fund. Now, on the continuing on the third impact, we also have psychological support for our older adults that perhaps may have some barriers to resources and services, to expedite the identification of healthcare access and adherence to mental health treatment. This is specifically for older adults. We also I heard that the council desired to do more programming at our city senior facilities to engage more our seniors to come back to the senior centers and have more opportunities for them. And also we realized that the caregivers that are taking care of those older adults that perhaps are experiencing mental health challenges need assistance. I think for some of us that have family members that are experiencing those challenges, you need help. You need some coaching. You need some assistance on how to take care of your loved ones. So that is another area that we are considering. And finally is the increase in our outreach teams to connect chronic and unsheltered homeless veterans to available mental health resources, substance abuse, and housing resources. So those are the programs that we have. This month of June and July, we are seeking input from our faith-based community. We're gonna have a couple of meetings with service providers. We're gonna have 2 public meetings. One is coming up this Saturday, and I'm gonna send in the dates because I don't remember off the top of my head, but we have one on Saturday at 10 in the morning, open to the public, just to get feedback on this proposed plan. And then we'll come back to the council in August, to the Public Safety Committee. If they approve the plan, moves to the full city council, and after the city council approves it, that's when we're gonna open a request for proposal process, a competitive process for service providers to help us to deliver these programs and strategies and achieve those outcomes. So I'm gonna stop right here and I'm gonna leave the slides if you want me to. If you guys have any questions or feedback, I can refer to those, or I can take them down, whatever you would like me to do, Anne.
Why don't we leave them up for a little bit? Our first question this morning too is whether your slides are available online or that you could send them to me and I could send them out.
I will send them to you, and they are online on our ARPA website, but I'll send them to you so it'll be easier for everybody to access them.
Great. I did send out the flyers yesterday with our notification about this morning. I did send out the flyers to everyone in English and in Spanish in terms of the 2 more sessions this Saturday and the one that follows. So everybody can refer to those to that email yesterday. A question here, would the warm line be instead of 988? I read that it's been very hard to find people to staff 988. Would it be hard to find people for the warm line? What I'm also thinking, there already is a warm line with NAMI. Could that somehow be utilized and further developed maybe with the funding instead of developing yet another warm line? That was my question.
Sure. All of those are options. We don't have anything set in stone. We just recognize the need that we need to have a warm line that can provide services to the community. I know that I'm aware of NAMI's warm line. I'm also aware of a Center for Healthcare Services line. We started to talk about the 988 line, if we perhaps using that as an option. So all those are alternatives that we can evaluate, again, with the goal of having a place where people can call for pre-crisis.
Great. Let's see, Deirdre did put in those dates in chat. Donna put in chat the current warm line with NAMI. And put in more information about those gathering times. Okay, those are chats. That's all I see in chat right now. I really want to encourage people to, I don't know, raise their hands and let's get some conversation going. I'm wondering, Maria, I'm thinking it's an and both, but which would be more helpful to you? to hear from these leaders in terms of how they see the monies being spent, like kind of generally, like where they would generally like to see things go, or would you like to hear specific like organizations or efforts? What would be helpful, most helpful to you, Maria?
What would be very helpful is if what I presented is within what you all think is needed in the community. If it's not, then you let me know and say, well, maybe modify what you have for seniors, maybe modify what you have for youth, or any of the other categories that I described generally. Also, I would say this was a lot of information. If you want to send me an email through or a comment through Ann or directly to my email, I'll be happy to take that as well. So are we within the ballpark? Are we missing something? As I said, it's $26 million, so it's not terribly a lot of money, and there's a lot of needs in the community. So I would like to hear that. The request for proposal process is another area that we want to come back to you once we have nailed down what is it that we are going to be proposing our partners to help us with, so we can talk about criteria, eligibility, and those types of things. If you are providers directly, we'll come back to the community with that.
Okay, what I'd like to do then, Maria, why don't you close the screen and drop the PowerPoint? And we're going to go to gallery, and we're going to use a hand process so we can get some deep insights here. So I invite everybody's insights, your wisdom. Lots of us have decades on us here in San Antonio, so bring that. This is a time to help Maria in this process forward. So Justin, what you got, man?
Yeah, Maria, thank you for your presentation. I think it's admirable what we're trying to do. I do know through my work over the last few years that there's a lot of things already happening. And I think one of the things I didn't see was a connection to the grassroots, kind of on the ground, community-based mental health care that's already happening. Bridges to Care has trained over 500 people through congregations, and somehow if we could quadruple that, triple that, 1,000 times that, whatever we need to do to get more people trained, that would be an amazing thing. I have found it to be life-changing for our congregation as well as for our community in ways that I could not have even imagined, and ways that I can't really explain. I mean, it's absolutely, it's a DNA cultural shift that has taken place in our community. Through NAMI and Bridges to Care, we already have the Behavioral Health Network. So the idea of bringing all the entities together to talk about strategies and how to best use funding and how to get people connected to services, that's already happening throughout the county and the city. And I think a way to boost that would be great to get more people involved with that, but that already is occurring. But I think really the grassroots level, a top-down type of idea, I don't think is going to work as well as a bottom-up. We've got to get really connected to the people who are struggling and who are going through trauma, especially in the communities where there's not a good network of therapists and psychologists and psychiatrists, and get into those neighborhoods, which we already are with Bridges to Care, and really boost those neighborhoods through the people who are already there. Thank you.
Just Maria, did you have a question or anything to Justin before we move on?
Yes, very quickly, on the connection to grassroots organization and the training you mentioned, Justin, is some of the thoughts that perhaps we should expand that training to have more people prepare to deal with?
Yeah, I would think the biggest thing I think that holds back Bridges to Care is funding to staff if we're going to expand the amount of training and the number of people going through training, we would need staff to do that. It takes some coordination. And so I think that's where some dollars could be spent in order to get more people trained.
Got it. Thank you. And then the behavioral health network, who is, I'm not familiar with it. Who leads that effort, Justin?
That is through Bridges to Care and NAMI.
Got it. Thank
Yep.
you.
Yep.
Justin, or maybe Donna, somebody from Bridges, NAMI, could you
Yes.
send Maria the list of that network so she knows who's in it? Or
I
a
can do that.
diagram or something. So
Mhm.
Mignon.
Good morning, everyone. Actually, Justin, you echoed what I was going to say, the funding for Bridges to Care, but I had a question. Ms. Maria, you made a comment about one of the substations having that mental health professional. One, I wanted to know which substation is that?
Is the central substation
Okay,
that's
And I-
located,
go ahead.
it's physically located downtown, and it serves a portion of our downtown area, north and south of downtown.
Okay,
It's
I
one of our
think that-
largest ones.
I think that's a great idea, and I think there was a mention of, I think there should be a mental health person trained at every substation. Particularly those areas. And I know in the downtown area, you have a lot of homelessness, and there's a lot of many of our brothers and sisters who are homeless are struggling with mental illness. So a definite increase in someone who's trained in mental wellness, who would go out with a police officer or go out instead of the police officer. I think that's a good direction for us to move in. And again, like Justin said, some kind of funding that would help even congregations as we're trying to provide services and push people back or point people back to Bridges to Care. Some of the things we're looking at is when people come to us, do we readily have a therapist available? And I was talking to Donna last night in how universities have visiting scholars. It would be great if we had a list of visiting therapists that would maybe be with the congregation for 3 months or 6 months, but that person has to be paid. So someone where we could increase the number of therapists that people have access to. And of course, that would require more funding. So thank you.
Do you have any questions, Maria, for Mignon?
Just wanted to make a comment. As we are thinking on how to spend this $26 million, is one-time funding, which means that when the grant expires, that's all the money that we have. So as we're thinking as a city on how best to utilize the funds for provider services, we'll fund those for maybe a couple of years, 2-3 years. So as you perhaps think of putting once we release the RFP, putting a proposal together, that's probably the number of years that there will be funding available for whatever programs we do. Thank you, Anne.
Thank you.
I've also put on the screen, I'll put also a link, but the outer circle on this diagram is the network that Justin was referring to. So everyone can easily see that. Stephen, you have your hand up.
Thank you. I know that homelessness is a critical situation in our city that has not been thoroughly talked about here today. And I'm just wondering, I know you've got a strategy, but you really didn't mark on homelessness. So would you explain if the strategy of homelessness is included in this ARPA strategy? And I have a suggestion on additional funding. I know Susan Cobo is online. This is a short-term funding fix, as you said, Maria. And we could, Susan, if you want to talk about it later, we can. Other cities have put into effect for permits. Whenever someone gets a permit for projects that are developed in the city, they're surcharged. Some cities surcharge extra in this permit process to continue funding in that regard. So homelessness is a critical situation, and additional funding cycles in the future. So that's what I wanted to talk about.
Sure, thank you for that question, Stephen. So this strategy does not address all of our homeless population. It's specifically based on the feedback we've heard from the council, is focused on veterans that are experiencing homelessness. With that said, we have other funding that we have received from the federal government that we are trying to identify potentially a facility where we can provide permanent supportive housing. And that funding is $20 million. It was allocated specifically for that. So that's a different process that we're following, and be happy to provide some information to Ann to share with everybody. Also, through the annual budget process, we are converting some of the positions that we added through CARES funding for homeless outreach coordinators in our Department of Human Services. We're going to transfer those to the general fund, so they're funded in perpetuity, if you will, unless something happens. So those are some of the investments that we're doing to enhance homelessness. But short answer to your question, this $26 million for mental health only focuses on veteran individuals who are experiencing homelessness.
Thank you, Maria. And by the way, when you said 26 million, wasn't that much money? There were probably quite a few people who fell off their chairs, because for a lot of us, 26,000 would be great, but 26 million just seems, the world. Donna, your hand is up.
Yes, I did have a couple of points, but I think Justin and Mignon expressed them so well. But a couple of things, I feel like what is already kind of been established through Bridges to Care, we've kind of got a foundation within communities to really grow what we see is working. And I can tell you that if we kind of invest in our faith communities who would like to have someone who is a trained peer within their membership, I know people would be totally supportive of that, because I say that the peer role in any environment only enhances that environment. And so as I was thinking, as you were talking and you were laying out the plan, in my head, I'm thinking, wow, what an incredible opportunity for a peer kind of role to be maybe even introduced to faith communities. Because as Bridges to Care, we are very open about, we're not trying to train clinicians. We're equipped, we want to equip with the knowledge to increase the awareness. But if you want to go to that next level, that level of support is to have someone within the faith community to be like a trained peer within that. But I also see another opportunity here. Could this opportunity look like expanding Bridges to Care trainings to a next level of training? Because we're in talks right now about how we can actually, grow our reach within the community. And so there are so many people that are talking about, Bridges to Care and Bridges to Care training. And then, okay, what's next? Because people go through all the trainings and do them all, and then they want to know that next level. And so what an opportunity for us to be able to grow to another level of training, to to have a certain certification for that next level. So it's just opportunities here. But I also wanted to talk about the potential to collaborate with not just faith communities within San Antonio, but we have faith communities outside of San Antonio who are wanting to be a part of this. So that's an opportunity too that I see that we could even look at growing outside of here, but that's a discussion down the road. But I'm excited about what we could do with all of this and how we could grow and really put San Antonio on, on the map nationally for what we're doing here. Because nationally, they're already talking about us in San Antonio as being a compassionate city. And I'm part of a think tank that's talking about youth and how we can address the youth crisis right now. And this is an opportunity for us to actually really look at that youth programming that you were talking about, Ms. Maria.
Donna, maybe you could I'm gonna pause. Maria, I want to respect your time. It is 8:40. I didn't know if you needed to leave.
I'm
Could you do-
available till 9 or 9:15.
Okay,
I'm good.
so we'll try not to go much more than 5 minutes for your time, but sorry about that. Donna, could you just quick for everybody and Maria as well, what training do folks get with Bridges? How much of that? What, just quick.
All right, so we have 6 core modules, and that's companionship, and that's how to be in safe relationship with people. I feel like that's the core and the foundation. We have suicide prevention that's provided by the Ecumenical Center, as well as becoming trauma informed. And we also have the mental health resourcing, and that's kind of like one of the last kind of trainings that we do within like the month rotation. So that way people know how to navigate, sacred.org. How do we access? How do we find out about resources? And then we also have domestic violence training, as well as mental health first aid for youth and adults. And we have 2 new trainings this month. The one time Dr. Andy Gray came up due to Uvalde, came up with a training to introduce the idea of a rapid response for faith communities. When a tragedy happens, could we potentially have a rapid response faith community that could go and support faith communities during that tragedy? And Dr. Jeff Gentry with Clarity will be doing a presentation on how to talk to children about Uvalde. And so the hours of training is 16 to 17 hours. And people are asking for more. So we're actually trying to add more to our training base, but also being mindful of our capacity level.
Thank you, Donna. Mary Jo, your hand was up. Do you still have a question? And you're muted. Mary Jo, you're muted. She's just talking away.
Okay.
Bless your
Right.
heart.
I just started going, but I just want to echo and support everything that Justin and Mignon have said about the Bridges to Care program. I've been in the mental health field for many years, done a lot of work in San Antonio in the mental health field and in corrections here. And I retired recently from the University Health System last year, but also did a period. I was a homeless outreach coordinator for the city of San Antonio. So I got to delve in that area. And I would tell you the city of San Antonio is doing amazing things in the area of homelessness. I don't think we really have to worry. I was there and we hired 10 professional clinicians in the area of mental health that are spread out to every single city council district. So that's a major resource that can be tapped in and spread around the city to provide mental health services. But when I retired, my priest, I thought I was going to retire. My priest asked me to see if I could come and help him because he was being overwhelmed by the number of individuals coming in for mental health services, particularly after COVID. And immediately I jumped on the bandwagon of Bridges to Care because I recognized the potential when I was with the city. We started collaborating with them. It's an amazing program. It's having major impact. It's widespread around the city of San Antonio. So there's 68 congregations. We are the first Catholic church to jump on board with St. Dominic's under the Archdiocese. And let me tell you, I've been spreading the word, trying to get other congregations to join. We have over 150 Catholic churches in the Archdiocese of San Antonio. And that is a gold mine in terms of really extending our resources for individuals that have mental health conditions. Every month now we're sponsoring mental health workshops. The first one we had 70 people. The second one we had 55 people come in. And they're not just coming from our parish. They're coming from the community. They're coming from other parishes. And the neat thing about the model at St. Dominic's is that I'm a clinician and I'm there. I work there. So it's a direct line to individuals that we identify that can be referred right there at the church. So you're right. If we have a clinician at every parish or as many parishes as we can, you can really touch so many people and really begin to provide community need. We have the training, and the training under Bridges Good Care, I have to say, has been phenomenal. And they keep bringing more and more training. So our people that are trained, we have 7 wellness champions already, and they're already coming up and saying, like, I helped a woman not commit suicide through this training. I mean, they're really utilizing all that knowledge that they're learning. So I want to echo that it would be great if we could get some funding for the faith base, because it's making a major impact in this city through Bridges to Care. So thank you.
And we have one last hand. And so we're going to make this the last hand and the last comment. Bill Neely with Sacred.
Yeah, thank you. I just wanted to say thank you for being here, and I want to just remind everyone here that the availability of services is one thing, and I think we're doing a great job in developing new programs and making sure that programs are funded. I just want to say that being able to find those services is also equally as important. So sacred.org is playing that role, and we intend to submit a request through your process. But I want to make sure that you're aware of what we do, and that that Sacred is it's a resource for being able to find all of these services that are there. So so it's not just enough to be able to create programs. You have to be able to locate them either as an individual or as a case manager or a social worker. And so Sacred is being used all over the city thousands of times every day. And so I just want to interject that it's having the services is important, but being able to find them easily through a central directory like sacred.org is equally key. So thank you for being here, and appreciate your time.
And I'll just echo that. Thank you all for being here. Thank you, Maria. Thank you all for investing your time and your commitment to our city. Maria, if people have thoughts later, should they send them to you, or what would be the easiest? You could all send them to me. I could maybe even compile them or something. So if you have thoughts later, just let me know and we'll get them there. How's that? Good.
That sounds great, Ann. I wanted just to take one quick minute to introduce a couple of team members from the city. We have Claude Jacob, who is our Metro Health Director. And he is oversees Metro Health, and there's a key component within Metro Health for mental health. So he recently hired Jessie Higgins, who's also here on the call. She is our mental health coordinator for the city for all the programs that we have. This is the first time that we'll have that person. So she's a great resource when it comes to all services related to the city. And I also see Deidre Murphy, and she's also with Metro Health, and she keeps us all in line, and she does a wonderful job. So I just wanted to recognize those 3 team members from the city. Thank you, Ann.
You're welcome. I tell you, that Deirdre, she's a ubiquitous keeping us all in line. I mean, she's in Metro Health, but she keeps me in line. So talk about reach. Anyway, thank you all for being here this morning. Again, thank you for your commitment and just wanting to be a part of this and make it work. So have great weekends, have a great day, and we'll see you next week at the intersection.